that we are still living through, hopefully the end of, uh, will change things, or whether we'll just go back to where we were before. Uh, I'm going to say quite a lot about cholera and 170 years ago in this talk quite quickly, because there are similarities and differences. If you don't know, the one of the most famous events with cholera was John Snow, the epidemiologist, also anaesthetist to the Queen, I think, taking a handle off a pump in Broad Street on the 8th of September 1854 and supposedly ending an epidemic. It's a kind of famous technological solution, sort of similar, if you like, now to the British vaccines. Isn't this great? That's how you do it. It all works. Cholera was a new disease. When you have new diseases, you really don't know what's going on. And you've lived through this for years, so you've got a sense of what that feels like. Um, we didn't know what spread cholera. We thought it was miasma. We thought it was the smell. There was even, I'll show you in a minute, somebody who thought it was lightning without the sound of thunder, or the other way around, thunder without the sound of lightning. And that's how you got a disease outbreak. Now, this may sound stupid to you, but just to tell you, we have no idea whether masks help us, or which masks help us, or what at the moment. These are things that we will discover in the next few years, but there's lots and lots of things we're doing through this pandemic which are not dissimilar to cholera because of the newness of the disease. Let me zoom on. It was actually vice versa. My slides are very detailed, so they're just really there for the recording. See if somebody wants to look back or doesn't believe me. Thunder without the sound of lightning was thought to cause cholera by Henry Ackland, a doctor in Oxford. He paid people to sit up a tower all day and all night and look out for lightning. And if they didn't see any lightning, but they heard thunder in a thunderstorm, he thought that correlated with cholera coming to the city. So it's a sense of not knowing what's going on. And here's the famous graph of the cholera outbreak in Soho. It gets high, it comes down. The pump handle was moved at the end. So in other words, it didn't stop the epidemic. Okay, so I hate to spoil anybody's idea of that famous story. If you type human geography into Wikipedia, what you get is this John Snow map. And it's this map of Soho, all these dots of people dying of cholera, and the cluster around Broad Street is in the middle of the map. But in fact, and this is the most famous map in my subject of geography, but the map wasn't used to identify the source of cholera. The map was drawn years later. You can tell it wasn't used to identify the source because the source is in the center of the map. So whoever drew the map knew what they were wanting to show before they started to draw the map. But anyway, there's your cholera. And what's key when it comes to cholera is that it was poorer people dying more than richer people. But what was also key was it was quite a good idea if the rich didn't know this. And the rich were actually incredibly fearful of cholera. It came in through the Russian court, and so they thought the aristocrats got it. And it was very useful that they were fearful of cholera because it made it possible to persuade them to fund sewer systems and so on. So an old disease, and I'll come back to this at the end. One reason why the dots cluster in this area is that the better off people have simply left. They'd gone, they'd got out. And that wasn't dissimilar, if you like, to COVID coming in March and April. Better off people I know who live in the middle of London suddenly found, I discovered so many of my better off colleagues had a second home in Devon, because that's where they were. Anyway, we've gone about the similarities. Too much. Maps of social class in London in the 1880s, zoom in to Broad Street and so on. Let's go forward to the current pandemic. So, and I'll show you a graph a bit later. The most important thing for COVID is age. More than anything else, what matters is how old you are. That affects your chances of being seriously ill, being hospitalized, or dying. And the relationship with age is so incredibly strong, I'm not even bothering to show you a graph. More children, I think, have died of chickenpox last year than have died of COVID. It's almost none. Very, very deadly if you're over 90. But after age, the most important thing is social class. And we know that from ONS data now, which says that poorer people, depending on how you do it, are 4 or 5 times more likely to have died of COVID than better off people. We don't talk about that much. We also didn't talk very much about what was happening before COVID hit. December 2019, the month before, or perhaps even the month in, when the very first cases were coming to Britain, the Institute of Public Policy Research produced a report suggesting that 131,000 premature deaths in the UK had occurred over 7 years as a direct result of austerity and the cuts. And you can see there they pinpoint it was the 3.6 billion drop in adult social workers. These are social workers who used to visit elderly people who are in dire need. They were cut. Over half of them went. 2012, 13, 14. Meals on Wheels were cut. Rural bus services were cut. It was the biggest cut in decades that happened from the coalition government of 2010 through to the Conservative government after 2015. They just kept on cutting. And we discovered that this had an effect on health, and it was direct. Government, of course, as you might guess, didn't say, oh yes, we are killing the elderly. They said, oh no, it's flu, it's influenza. It wasn't. We didn't have a series of flu pandemics. We now know what a pandemic is. But they kind of got away with it. They got away with saying it's flu. You may have heard of this story, you may not have heard of this story. In case you're thinking, oh, he's making it up, here's the graph. This is from the Health Foundation. Each of these little dots is a year, and it's the age standardised mortality rate for England and Wales in that year. And you can see it coming down and down and down and down and down until a year after the general election of 2010, where it flatlines. Okay? And take my word for it, before the year 2000, that had been coming down for a century. As life expectancy goes up, and it goes up almost every year for a century, barring world wars and so on, and the influenza pandemic of 1819, 1818, this improves, but bang comes to a shuddering halt around about 2010. The best year was 2014. That was our highest life expectancy, our lowest age sex standardized mortality rate, but it's not good. The response to these findings was pretty minimal. I think the reason it's minimal was that the people who were dying were poor. The people who were dying, above all else, they were elderly. In particular, they were elderly women, more than elderly men, but they were poor. In 2014 is when we first identified it. Elderly women, women over 75, their life expectancy fell by just 2 weeks. Why were elderly women more likely to die when you have austerity and cuts? They're much more likely to live on their own. Elderly men were much more likely to be living with a wife, because for that generation, they tended to get married, they tended to have wives, they tended to marry a woman 5 years younger than them, and men tend to die 5 years earlier than women. So men do better in austerity because there's somebody with them. But it was mainly women and poor. And for the kind of middle-aged, middle class, okay, a bit if you're kind of Guardian reading lefty like me, it's a bit sad, but it's not going to happen to you. Now, interestingly, COVID's the other way around. COVID originally comes into the country from people who've been on skiing holidays in Italy and youngsters clubbing in Ibiza. That's probably the route in which it arrived. It first of all hits parts of the southeast that are pretty affluent, gets its way into Kensington, hits the Prime Minister, numerous celebrities and so on. Very different. Men die more from COVID than women. We don't know why. Although again, remember, men are more likely not to be on their own. And although it's absolutely awful living on your own in the time of COVID, purely biologically, in terms of not getting a disease, you're safer if you live on your own than if you live with a partner. Because if the other one gets it, you may well get it. That's about austerity. Zooming forward, this is just a slide I put in to sort of admit how wrong I get things. I published this in March the 24th. The day after I went to London. Last time I went to London was March 23rd. That's a year ago. Which turned out to be the day of highest infection rates. The highest death toll was 2 weeks later. And I published this little bar chart showing how low deaths were in 2020, since COVID is spreading everywhere. We'd only had 90,940 deaths from weeks 3 to weeks 10 of the year. And if you compare that to 2018 or 2015, this was small. I wasn't saying COVID wasn't going to be big. I was just saying at the moment, COVID would have to kill at least 10,000 people to catch up with this, or actually more. In 2015, we had 50,000 excess deaths. You may well not remember, but we closed hospitals for all but emergency surgery. All elective operations were closed twice in this period of austerity. And the strange map here is a world map stretched. Time of incredible naivety. It's a world map where countries are the size of the number of COVID deaths, I think, and China, which has had such a tiny number of COVID cases, was not much smaller at that time than Europe, just arrived. I draw weird graphs. These are the weird graphs of the COVID epidemic beginning by April, zooming up and up. Speed is very, very fast. This kind of gets your attention. The absolute opposite to slow deaths from austerity and circumstantial evidence mounting over years is a pandemic. Completely different. Absolutely grabs your attention. Here's the data that ONS released in December about social class. At the extreme, if you take associate professionals, so lower grade teacher, age standardized mortality rate of about 7 or 8 per 100,000, compared to somebody working in on a production line of about 35. So that's a 5-fold difference. Now, it's a bit unfair to pick teachers. They're actually on the average because they were near to children. But if you were to pick somebody working in a abattoir, they have a much higher chance of getting COVID. But these social class differences are very large. 3, 4, 5 times more likely. Why? It's pretty easy to imagine it now. But if you work, say, at a supermarket till, you may meet 2,000 people in a day who are strangers to you. 2,000 brief interactions. You can work out how many 15-minute or 30-minute equivalent interactions that is with somebody. Just because somebody stands at a till for 5 minutes near you doesn't mean it's okay if there's another one, another one, another one, and so on. Now, compare that to my job. I might occasionally meet one student a week if it really has to happen, and it's a world away, absolutely a world away. And these are some of the reasons. The first officially recorded death was March the 5th, 2020, a woman in her 70s. But the Prime Minister said that it was highly likely the virus would spread in a significant way at that point. Going forward, March the 16th was when 30 sciences on the paper, not just Neil Ferguson, but their model predicted 510,000 deaths. And it was greeted with incredulity, not least because that modelling group had predicted similar very high number of deaths 4 or 5 times in the past. It actually doesn't look so silly now. That was in an unmitigated scenario. We've had mitigation. And as I said about masks, we just don't know which mitigations have helped and which haven't helped. But the difference between our incredible forensic interrogation of this pandemic and what we can do and who it's affecting, compared to the 7 years before, where as many people died early, is really quite staggering. And just to get on, if you sort of think this doesn't matter, sort of punchline at the end, but I might as well tell you now, you probably know of all countries that are large in the world with 12 million people or above, we currently have the highest mortality rate in the world from COVID. It's 18 per 10,000. It's not the end of the world, 18 per 10,000, it's the highest in the world. Try to imagine what that mortality rate would have been if we hadn't had 130,000 frail elderly people die due to austerity beforehand. Imagine if we were like Italy or Spain or France or Germany, where people live longer than us. And so we had a much older population than we do when COVID hit. We wouldn't just have the highest mortality rate in the world, we'd be 50% above the next country. And it's a sort of sad thing to think about, but our deaths from COVID are only at the highest rate in the world, but not higher, because we actually have a lower life expectancy than elsewhere in Europe because of all the deaths that occurred, because life expectancy peaked in 2014. Um, taking you forward at the beginning of this, just trying to remember these weird graphs. I don't have time to explain them, but they kind of show it shooting up. China and Germany then seem to be different. There are all kinds of things we thought we knew. You know, if we just behave like the Germans, we'll be fine. So the second wave, Germany is just as really badly affected. Acrimony, argument. Hopefully you'll have some of me. I'm trying not to annoy you, but you know, the pandemic has been full of, well, people of my age, epidemiologists and scientists. I'm not a geographer, which is great because I don't have to know that much about these things. Absolutely going for each other. Some arguing for zero COVID, we can clear ourselves of this. Others saying you've got to get herd immunity, all kinds of things. You always get this acrimony with new disease because you don't know. John Snow quote, the question of contagion in various diseases has often been discussed with a degree of acrimony that's unusual in medical scientific inquiries. This is what he was saying in 1853. The cause of the warmth of feeling that's been displayed has in most cases probably been unknown to disputants. Why is there so much argument? It is the great pecuniary interest involved in the question on account of its connection with quarantine. It's the money. The problem's the money, and this gets you back to social class and poverty and inequality. Saying that everybody should be locked down and not move is fine if you're well off. Some of the people arguing for the strongest have been very, very, very well off individuals. Telling somebody to lock down if they are poor, telling them they can't go out of a flat, telling them that they can't go to their job and get their income is very, very different. So there's questions of money involved in this. This is the rise of deaths per day at the beginning, just to show you just again how quick it was. The shock from, you know, the beginning of March, we go, oh, something interesting is going on in China. And what's happening in Italy? To 1,000 deaths a day at the peak, really, really quickly when the Prime Minister went into hospital. What's the worst of the pecuniary interest? We have 4 million people in Britain who've lost their income and are not allowed to get any money from government. Often they're people who may have set up a business recently and have no tax records. There's all kinds of reasons. It's a Standard Life Foundation report. I think it came out last week. Of those 4 million, 1.8 million have lost over a third of their income. They haven't managed to replace it with anything. They have had a huge drop of over a third, at least a third, in some cases half, in some cases 2/3. Often that income would have been small. If they can get to a food bank, okay, but some of them will be starving. That's the extreme of poverty and COVID that Standard Life have come out with. That's the people who are not covered by benefits. When it comes to benefits, we've halved our benefits in real terms in the last 30 years. We have some of the lowest benefits in Europe. The government increased them by £20 a week. That £20 a week is vital, but you know, think, what on earth would you do with an extra £20 a week? Would it make that much difference to your life? Now, for people on benefits, it does. It's only £1,000 a year. I think Sunak has confirmed it will carry on in the budget, but he actually thought about cutting it, which is the kind of extreme case we are in Britain. These, misspelt title, these graphs are just slightly geeky, but to tell you that by April 17th, we knew it had spread everywhere. There are 7,201 middle layer super output areas in England and Wales. And this is the distribution of deaths amongst them. And if you do it on a log scale, you see you have this incredible linear relationship. It just means it was everywhere. By April, it was everywhere. And that's in terms of deaths. Nowhere without a death, which meant it had spread everywhere in February and March. That's part of why Britain was so bad. Partly Heathrow, partly we have London, partly all the roads lead to London. Italy is kind of luckily more divided. The south didn't get it. But huge inequalities, the highest income inequalities in Europe, an incredibly centralized country. COVID spreads everywhere, and we get that effect. I won't read all of this out to you. I'll just read the quote, which was the BMJ, again last week, I think. BMJ article, and I've put the reference there, made a claim that the authors of the BMJ article thought that the BMJ editor would delete from their article. So this is the most interesting sentence, which is, this pandemic has seen an unprecedented intergenerational transfer of harms and costs from elderly, socially economically privileged people to disadvantaged children. So their claim is that the way we have dealt with COVID, our policies, have been to the benefit most of pretty well-off elderly people, to try to protect them by telling everybody else not to move and so on, by sending all the children home from school. And the people who've lost out, even though their chances of being ill are very low, are children, and especially the most disadvantaged children. School, if you're a poor child, school is your only way out of poverty. Not your parents, nothing else will help. Your one chance is school. Take that away, hold it back, and that's kind of it. The reasons for children going back to school aren't economic. The main reasons are health. It's things like suicide attempts amongst children. I won't go into all of it, it's very sort of distressing. But if you hadn't seen this kind of argument, this argument isn't put forward that much, because we've had an interesting politics of this pandemic, almost the opposite to the politics of AIDS. You have to be my age to remember AIDS, the height of it. At the height of the politics of AIDS, the right wing wanted to stop people being able to come into the country, or for them to be tested in case they came in with AIDS and so on. The left wing, people on the left of politics, were in favour of trying to destigmatise AIDS and look after it. Now, interestingly, with COVID, we have the other way around. The left wing have been trying to say, don't let people in the country lock down, and also shut down schools, which is to this benefit particularly of poorer children. So it's been very, very, very fraught. That's the last of these diagrams of showing it absolutely exploding. But no, China tiny, Germany tiny, USA. I ship there might be one more just going off. Whatever we did the wrong thing. You don't end up with the highest rate in the world by March 2021 if you hadn't made a series of mistakes. So it's possible to argue about the right thing, but whatever we didn't do it well, as good as we could have done. But we're going to be telling a heroic story of vaccines now, and of the very, very British vaccine, and of the 20 million people vaccinated, and against remembering that we already had 131 premature deaths before the pandemic began, and then we had another 130,000. COVID down to. It's probably 0.5% of those infected getting it. If you want to talk about Singapore, and there's loads coming about Singapore and Southeast Asia, I'm happy to. Some things were unavoidable. So in 19 East Asian countries, there hasn't been many people dying of COVID. And the reasons for that are complicated, but it is possible that whatever a European country did, it couldn't get COVID as low as Japan, Taiwan, Korea, Laos, Vietnam, Cambodia, Mongolia. Our best off countries in Europe for COVID, Finland, Norway, Iceland, each have 10 times the number of deaths of their equivalent country in Southeast Asia. Finland, it's less than 800 have died over the whole time. And they're really worried about it now. Just to give you a sense of enormous differences across Europe. The actual first death, now we know, was of a man in his 80s in Kent who died on the 30th of January. So, just in case you're wondering about this, it had spread all over. We now know much more about how it has spread all over. And in fact, there was a lot of COVID in Britain in January. And it doesn't really matter that it came to us first, but it's just interesting how we want to kind of say it was the Spanish and the Italians and so on. We have Heathrow, we have more international travel, and that isn't our fault. This is just the first wave. These graphs are from the first wave. There's the decline, very slow, which is partly why the death rate was so high, because it went down much more slower than it went up. This time, the second wave has declined really fast, much faster than actually the rise of the second wave, and the rise was slow. These are the regional waves, incredibly similar to each other. You know, it had a week's advantage in London. That was all. Everywhere this thing goes up. And there's the very last of the graph, just showing the USA as the dark blue, getting really high numbers every day. And another graph just highlighting that the black is what a symmetrical distribution would be, and the red is what really happened, just and showing how much slower the fall in deaths was than the rise of the first wave. And we didn't know here. We didn't know whether there'd be a second wave or not. Of course, people now will say, human beings love to say how much they knew was going to happen. If anybody tells you that they knew and they got everything right, just ask them, what's going to happen in 2022, 2023 and 24 then? And then watch them stumble over telling you with their amazing predictive powers what will happen in the future. But people are very willing to tell you they knew what was going to happen in the past. Just going to tell you very briefly, I will keep to time, but just how bad was this compared to previous things? It was pretty bad, but not completely out of sync. So this is a 1951 flu epidemic, wasn't even a pandemic. In the great towns, flu was killing 10,000 people a day in England in 1951. COVID, the same equivalent, was 9,000. So it's worse than flu, but you can find flus that have been bad in our past. Now remember, in 1951, we didn't have very many elderly people. So that's quite dramatic. 1948 was a really good year. So just showing you the difference. 2017 to 2020, similar. This is Liverpool, which did particularly badly in 1951. Had 450 deaths a week. Liverpool with COVID, 120. So it's not completely unprecedented. But we had different attitudes to deaths in the past. After 1951, which was just an epidemic, the next big flu pandemic was 1957. And in the worst weeks of the 1957 flu pandemic, the Prime Minister, Howard Macmillan, told the population they'd never had it so good economically, which shows an incredible difference in attitudes to deaths. And that's what we remember. We remember him saying, you've never had it so good. We don't remember the 1957 flu pandemic. On the ranking of how bad was this, the worst years for mortality, I think in the last 166 years, 1918, which was a massive influenza pandemic and war, 23% increase in deaths in a year. 1940, which is war, bombing, disease, 16% rise in the deaths. 1929, which is a very cold winter, you get a rise of 16%. The Great Freeze of 1895, and then COVID. So fifth in terms of absolute rise in mortality, but we have lots and lots of very elderly people who can die compared to those earlier years. And cholera, a bit smaller, 1846, 1849. Life expectancy, these are the rises. This is life expectancy for England from 2020. The top is women, you see it going up and up and up. The lower lines are men, you see it going up and up. And believe me, it's been doing that for 100 years. The reason it rose at the beginning was different. It was infant mortality falling. Later on, it's stopping smoking, all kinds of things. But, you know, a quarter of a year improvements. And then flat lines after 2011, 2012. And then we lose a year with COVID. And that's what I want you to imagine is, imagine if that had carried on, that improvement, like it does in Scandinavia, or Germany, or Japan. Imagine if that rate for women had carried on going up. So what we've really lost is this much, 2 or 3 years, not the 1 year from COVID, but we only think of the COVID because it's nice, it's newsworthy, we can understand it, it's not political, it's not difficult to understand. But the important thing is to understand this flatlining. That's what was happening before. Getting very near to the end. It's been a bit much listening to my voice and zooming through it. The second epidemiologist, William Budd, writing in 1849 after a cholera epidemic, and talking about the importance of the rich and the poor, because as they were finding that epidemics affect poor people more then, as we're going to increasingly find with COVID, it'll be a disease much more of poorer people, poorer areas, poorer countries in the future. And the quote is, how important it is, even in regard to their own interests, for the rich to attend to the physical wants of the poor. To do this is one of our first and plainest duties. The duty itself we may evade, but we cannot evade the sure penalties of its neglect. By reason of our common humanity, we are all more nearly related than we are apt to think. The members of the great human family are, in fact, bound together by 1,000 secret ties, of whose very existence the world in general little dreams. And he that was never yet connected with his poorer neighbour by deeds of charity or love may one day find, when it is too late, that he is connected with him by a bond which may bring them both at once to a common grave, and that being infectious disease. Bud was writing in the years immediately after A Christmas Carol was published by Charles Dickens, so I think there's a bit of that in there, but it's the understanding of the connections between people, and the question of, to what extent did Britain do so badly with COVID, partly because it had done so badly before, and we weakened the population and we'd decimated public health, and our NHS was incredibly run down, despite the fact, and it's complicating, that we killed off 131,000 frail people, making the statistics not look as bad as they might have done. This is my last slide, so please think of some questions. I have managed to keep the time, I think. The story of 2020 and 2021 will be written and rewritten and written again. It will hopefully be the defining part of the defining years of your lives. I'll say hopefully because you don't want something as bad to happen again. It'll be the thing that you bore people stupid about in 30 or 40 years' time when you talk to them about having lived through it. And it's nothing like a war, but it's the most significant thing since World War II. And what I worry is that we're going to get a jingoistic, weren't the British great story. We bought 400 million vaccines. We did this. And we will forget the story of how awful we were for years beforehand and just how bad it was here globally. And if we'd had a decent public health service and hadn't cut it before, if we hadn't created Public Health England, which was a Conservative invention, if we'd allowed local well-funded health authorities to be in charge of track and trace from the beginning, if we had the kind of welfare system that they have in the Netherlands or in Germany so that people could actually afford to isolate, if, it need not have been as bad as it was. And I think that's the story that needs to be told as we come out, and not the story of plucky putting needles in arms, because vaccines are not that difficult to do. But it's a nice, you can all be very proud story, just like the story of Jon Snow taking the handle off the pump, but it isn't the key issue. Thank you very much for putting up with me, and please ask anything you like or criticise me for anything I've said.
Well, thank you very much for taking the time to give that talk. I think that was, I definitely learned a lot. I thought that was really important and really interesting. So thank you very much. As Dr. Dorling said, we do have a few minutes now for Q&A. So if you do have any questions for him or anything you want to discuss, just post it in the chat. And if you can also send it to me directly, if you'd prefer, and I'll read the questions from the chat out to him. And so we can just spend a couple of minutes on that if anyone has questions. And I'll start with my own question first, just because I have one. I can see that the questions are starting to come through though. So very briefly, just at the end, maybe this is a bit pedantic, but you mentioned that Public Health England came from the Conservative government. And I was just wondering what your thoughts are about Public Health England and the kind of implication that was bad for our response to COVID, and what those links were, if that makes sense.
Okay, I mean, it's a bit, people are normally politer in England about this, but I think this will be part of the story. The Conservatives coalition created Public Health England. And if you look at its early work and what it advocated, it was very much in a kind of blame the victim mold. It was a breakaway from the dominant public health message, which had grown up from people like Michael Marmot and so on in the 90s and early 2000s, that the real cause of poor health is poverty and inequality, and you have to solve that, and large unemployment causes it, and so on. And it was very much more of the don't eat crisps, don't get fat, don't drink too much public health thing. And fascinatingly, after that kind of look after yourself and behave yourself, an absolute fascination with viruses and infectious diseases. Public Health England loved infectious diseases. That was what they saw as public health. The rest of it was your own individual responsibility. And you can see it in the things that were said and the responses. So when we started to get more deaths because of austerity, Public Health England tried to claim it was the flu. The problem was it was a very special kind of flu that only hit Britain and didn't hit nearby countries with better welfare states that weren't making the cuts. So I think in hindsight, that story shouldn't be forgotten. And then, of course, when you finally do get an infectious disease, the thing that Public Health England quite kind of liked and thought this is what government should be interested in. It's a kind of night watchman state, do as little as you can, but government should look after the army, the navy, and worry about a global pandemic. When they do get it, they were pretty useless, to the point of even the Conservatives, I think, sort of disbanding them and creating new things. So I don't want to be mean, but it's not a good model compared to the more stable models of public health of other countries. And the incredible model of somewhere like Finland, which I've written a book with Anika about Finland. Finland had been stockpiling PPE since 1957, because they could remember what a pandemic was like. Whereas we had just privatized our PPE systems. They'd actually sold them out to tender to whoever could provide PPE for the cheapest by doing it in a just-in-time system where you wouldn't store any of it. You just buy it from China when you needed it, right? We'd only done that. It's stupid and uncaring. I won't dig myself in further on that.
Yeah, I can see how that wasn't didn't necessarily line up with what we experienced with the beginning of coronavirus. But I think that kind of ties quite nicely into some of the questions that I'm going through on the chat. So Nikhil has asked, what are your ideas on building back fairer? So kind of what could we be doing to make it more even?
That's good. What will happen is that we'll be told we're building back fairer, and we're going to hear about 40 hospitals endlessly. The government are going to build 40 hospitals. We'll hear a lot about that. And hospital, of course, could be any size. But I don't think there will be a building back fairer from this current government. What may happen more in the long term, this is part of the recession and COVID, we've lost 1 million people. 1 million people have left. And they've left mainly because of COVID, partly because of Brexit, and most of from the mainland of Europe. But the reasons we think they've left is that, if you're from France and you're working in London as a midwife, it's very expensive. Most of your salary goes on the rent, but at least you can fly back and see your boyfriend or girlfriend or mum and dad. Once COVID stops you being able to do that, what's the point of hanging on there in London? So we've lost 1 million people from London. We may get to sort of building back fairer from the recession affecting the southeast and London more than other places, and that may begin a levelling out. And the government are doing all they can to stop that. So they're talking about continuing stamp duty on housing past the budget. They're talking about a new Help to Buy, where the Chancellor tries to make it easier for you to borrow money to buy a house. They've spent more money since 2010 on trying to hold house prices as high as possible than anything else. That's what all the Help to Buy and all the schemes are, is to stop house prices falling. And you may think this is strange, but governments see high house prices in London and the South East as a measure of economic success. It's a market signal. They're only that high because people can afford them. It shows that London's doing well. So leveling up partly would involve not having the highest house prices in Europe for some of the lowest quality housing, and making things better in poorer parts of the country as well. But this government are really, really, really against it, because their vote is about people who own housing and property, and they'll do anything they can to actually keep the inequalities going while talking about making things more equal. And I don't think they're that Machiavellian. I just don't think they thought it through.
And I think that ties into the question that Emma raised in the chat, which is, even if funding for public health is increased in the near future, how long do you think the impacts of these years of austerity will be felt and seen in the statistics, like life expectancy?
Yeah, that's tricky. So when you damage elderly people, like elderly women in 2012 and 13, you get a very fast effect on life expectancy, because they die, and you can see it in the statistics. But when you do something which damages the health of a child but doesn't kill them, but means that they die 10 years later, it's a very long lag, and that's almost impossible to show until the time has gone. But this is part of the worry of scarring a generation. There are other slightly ridiculous things, like I may have got this wrong, but we run a marketised university system. You're in one, whereas Scotland's less so. So in Scotland, the dental students, I think, have been told they're going to have to do another year, so they actually know how to be dentists, because they haven't managed for this year to learn how to be dentists. But in England, we're not going to give them an extra year. We're just going to chuck them out to learn. Those kind of attitudes have effect on health. In this case, not so good. Dentists doing things with your teeth that they probably shouldn't be doing. So sorry for not a very complete answer, but it's the immediacy of things that affect the health of very old people do affect life expectancy statistics quite quickly and not slowly.
And I think, obviously, like you were saying, the things that affect children will have a much longer kind of tail on them in terms of life expectancy. And so I got a private message through that kind of asks around that issue, which is there any way to rectify the educational losses that poorer children will have faced throughout the pandemic relative to their more well-off peers?
Oh yeah, no, you could. There's lots of things you could do. There's nothing that's cheap or easy. So the most dramatic thing government could have done is what it did with the private hospitals. With the private hospitals, they were sort of requisitioned, although the people who own them got a lot of money in 2020 for this, and they were used as part of the national health system. That's partly because, of course, the private hospitals couldn't operate because of COVID, but you can do that. And in past times, of course, we've done this. The NHS was created not by building it, but by requisitioning private, charity, and other buildings, putting them all together in 1948. With education, what we could have done, not with this government, but you can imagine a radical one, we could have said, when it became clear in April and May, the huge problem we have, we need a lot more space and a lot more buildings to educate these children in, and we need a lot more teachers. And we're unique in Europe. We're the only country where we spend about a quarter to a third of our education spending on just 7% of children, which is the 7% who go privately. And we don't call that our spending because it's private spending. And this just doesn't happen in other European countries. After us, it's Chile. What you could have done at the extreme was, we could say we've got a national crisis. We're going to use all the education buildings, put marquees up on the playing fields of some of North London Collegiate and Magdalen College School in Oxford and so on. Take the teaching staff and all the TAs in these private schools. There's an enormous number, 3 times as many teaching staff per head than in state schools. And we could have had a national education service for a year. Now, that sounds ridiculous. Maybe politically it might not have been possible, But compared to what has happened, anyway, that ain't going to happen. But you could imagine at some point a government coming in and saying, we can't carry on spending so little on educating 93% of people, cutting it in real terms, as it's been done, crowding them into classrooms, which are so tightly packed, even when you don't have COVID, and having a model that's like this. We have the most unequal education system in Europe. I sound like a broken record on these things, but I'm talking to you from Oxford. A third of our 15-year-olds go private. Their parents, that's a third of children in the city. And then between the state schools of the city, there's £100,000 house price difference between the catchment of each one in a tiny city of 150,000 people. The bottom ranked school in Oxford ranks amongst the bottom in the whole of Europe. Maybe 2 or 3 children go to university from it a year. The top ranked ones, it's a real achievement not to go to university. It's almost impossible. The children don't mix socially, don't play together, might occasionally play football, but and this is a little town. And you've got the same in Cambridge, not quite as bad, but sort of similar things going on. You've got an FE college that takes children from the whole of Cambridgeshire if they pass certain exams. They don't mix with other children and so on. It's not normal. The opposite, of course, is Finland, where the difference between the schools in Finland are tiny. You don't worry about what your child goes to. And the quality of education is far higher than anywhere in England. Better than Eton. Children can speak 6 languages or 8. They score better at maths than we do. It goes on and on and on. Oh, and by the way, it costs less. It costs less even than our state education system. And they've had free school meals since the 1940s, and they're just called free meals because nobody pays. You just eat at school. And that's the other extreme in Europe to us. But we are a very odd country. There are reasons why we're odd. Our school and university system were brilliant for creating a successful empire, for teaching people their place, for teaching people they can lead, for giving people confidence. And it's really good if you want to take over Nigeria. It's just not a very good education system if you shrunk into yourself and you're a small country on the edge of Europe, and you should be getting on with each other. It doesn't teach people to get on with each other. It teaches them how to give orders. And it teaches other people how to take orders and doff their cap and keep their eyes down and don't look up and don't question. And it annoys me. But we have it for historical reasons.
Yeah, I grew up in Cambridge, so I'm definitely aware of that it's not a particularly equal city. But
Oxford and Cambridge, by the way, compete for which is the most unequal city in all of England. And I think Cambridge actually just about wins on some measure.
Yeah, I've heard.
So, and my co-author was a Cambridge, Aniko, who's Finnish, was a student in Cambridge. And so we begin the book on Finland about Cambridge and actually the city of Cambridge and her impressions of turning up and seeing it.
Yeah, I've definitely heard from other students who come from other, perhaps more equal parts of the UK that they're very surprised by the level of inequality in the city.
Yeah.
So this is a slightly different question, a bit of a tangent from the other ones, but someone was asking, they've recently heard or read that the UK government attributing the vaccine rollout success was partly to our independence from the EU, sorry. So they just wanted to know your thoughts on that and whether it is linked to, I guess, Brexit and us being a little bit divorced from the rest of Europe.
Yeah, they're going to claim that. So no, it isn't. But vaccines are incredibly jingoistic things. So part of the reason we know why it isn't is that different European countries have different rules about accepting vaccines. So the Swiss, I don't think the Swiss, have they? I don't think they've just, I've forgotten who's allowed 65 plus year old. Well, it's France. France now says you can take the AstraZeneca vaccine in France. Switzerland doesn't. I think Germany still. It's all done separately in Europe. the idea that there's a European monolith. Europe did muck up the purchase of vaccines, but, and this is my prediction for when somebody, not me, writes the book of this, I suspect we managed to buy so many doses so early and the right ones because we have more insiders in the dodgy pharmaceutical industry than other people do. And that'll be, the story comes out of how did Britain know to get this one and who put in the bid. It won't be quite as clean as the story told now, even to the point possibly of money having passed hands in some, some way. We'll find out, but this kind of heroic story about getting the vaccines. I mean, it was an irony because you're in Cambridge. You're the science university, right? And I'm in the humanities university. So how come Oxford does a vaccine? Oxford does a vaccine because vaccine is old and boring science, and we were still doing vaccines because it's old and boring kind of stuff. But no, I don't think it's that. The other really important thing with the vaccines is China and Russia, and particularly China, because of course China got their vaccine out earlier. We don't talk about China vaccine because we're still in a kind of Cold War where we pretend that, oh, they can't possibly work. And the same with Russia. But China is exporting most of its vaccine and not using it internally. And that shows a degree of confidence in China about the virus and so on, which is much higher, and possibly it may spread. It may find it harder to spread in China than here. But no, not necessarily. Certainly not because of Brexit, but it will be interesting to know. The really interesting one is Switzerland, because the place that really should have the insider knowledge on the pharmaceutical industry is Switzerland. So why didn't they get, or have they? Why aren't they not ahead? And of course, Switzerland is not part of the EU at all. So if it's not being part of the EU, why haven't Switzerland got ahead? So it can't be that easy story. Well, the one good thing we have done though is we have tested it on, because the trials were not on elderly, frail people. So us and Israel have actually done a service for the world by testing our elderly and frail and just checking what happens with this. So it's happened now, it's fine, it works, it doesn't kill them. We know that. People have been looking at the actual data, but in a sense, and it was worth the risk, but it's not all bad news. We have done that service.
Just with an eye on the time, I think we've got time for maybe one or two other questions. I have been having some other questions through on the chat, but I'm not sure we'll quite get a chance to answer all of them, unfortunately. But just in order of when they were sent, so the next one would be, you probably know that the government is planning a new major overhaul of the NHS in England. Could you give me your thoughts on their proposals, whether they will reduce or exacerbate health inequalities?
Depends who you listen to. The person I listen to is Alison Pollock, who was on Independence Age at one point and has looked at this for years. So spelled P-O-L-L-O-C-K. Alison thinks it's more privatization and introduction of US private companies through the back door, but brilliantly press released as if it was the opposite. So the BBC story on it was, oh, this will be less tendering, this will be more like the rollback of the 2012 Andrew Lansley Act. But the set of people, Matt Hancock, Sunak, Johnson, have not suddenly become socialists. And of course, at the top of NHS England, we have people whose background is in the US private insurance health industry. The US health industry sees Britain as its kind of way out of the US. Where can it expand to next? And us leaving Europe makes it easier. So I think there's an attempt there to do that. And it's part of the Brexit, it's part of the trade, and the idea we become swashbuckling. Somebody's put up a Guardian story. 500,000 patients passes in the hand of a US health insurer. I think those were GP practices in London that did that a few weeks ago. I am hopeful, though. I am optimistic. I do think this has shocked the Conservative Party, and some of them, particularly the older ones like Boris. By older, I mean about my age, a couple of years older than me. My view is that they've generally held opinions since they were teenagers that were fairly extreme. They loved Margaret Thatcher as a teenager; she was their prime minister, and they've held these opinions that it's survival of the fittest. You let the market rip. If you're poor, it's because you haven't tried hard enough. All that kind of thing. And I think COVID in their lives and seeing it has been the first kind of thing that's actually happened to them and involved them that may have made them stop and think and be a bit different. And I'm kind of always optimistic, but it could be a turning point in Britain. And turning points are always slow in Britain. They're painfully slow. But the furlough scheme, doing that, actually realizing that you can't let unemployment rise to 3 million, 4 million again. That's a break from what Mrs. Thatcher did, where she simply let it rise that high in the 1980s. But the next year will tell. Now's the time of choices. There's 100,000 families about to face landlords trying to evict them as soon as that's allowed in the summer. What does the government do about 100,000 families behind with the rent whose landlords want to get them out? They're actually faced with these choices where they have to act quickly, and they can't do what they did in the past, which is slowly make life worse for people. So you slowly notice there's more and more unemployed on the streets, but you don't link it to government policies. In the recession we're in now and the crisis we're in now is immediate, about people being fed properly and people actually having shelter. And I'm hopeful that we've reached kind of peak extreme right. And the last thing to say on that, if you don't, in 2014, the Conservative Party left the major European Conservative bloc, the European People's Party, and it joined an alliance of far-right Europeans. This is public knowledge, which included Alternative for Deutschland, which is the far-right German party. And until Brexit, we were the largest members of the far-right group, 40 MEPs, UKIP and Tory in those groups, along with the Polish Justice and Law Party and Golden Dawn. The one good thing about Brexit is that the European far right lost 40 MEPs and is now in disarray with having to rely on 20 Polish MEPs as the largest far right group. It's not nice to think of your country as the core and hotbed of far right politics in Europe, but we were. And so for optimism, all we've got to do is to stop being the most extreme country in Europe politically, stop having the highest income inequality, stop having falling life expectancy since 2014, stop having rising infant mortality, which we had uniquely in Europe, and just stop being bottom of the class. And things will get better in your lifetimes just by us not being completely abysmal. Now, you can't sell that as a policy. I can't go out and say that publicly because I sound completely mad, but it's like what I say about our education system. Unbelievably inefficient, spending more money on the children who do best at school than the others. And the opposite, which country spends more on the quarter of children who do worse at school? It's Finland. Because you don't need to spend more money on bright kids, because bright kids are bright kids and they can teach and learn themselves. And they don't need extra help. And it's the kind of, these are the kind of struggles that we have, I think, to try to become normal. And the things that hold us back are these beliefs that you must spend the most on the rich because their children have special genes, which means that they're going to be super clever and they will make Britain great again. These kind of utterly mad ideas from a Victorian eugenic past that still kind of quietly hold sway in parts of British society.
So I'm aware that we're a little bit over time. I'm gonna, if you have time, I'm gonna sneak in one last question.
Okay, I'll promise my answer will be shorter.
Unfortunately, we only have time for one more. So it's quite a nice question to end on, I think. It was just, are there things I can't speak today, sorry, amidst all of this to give you hope for improvement? So is there anything that you think could point to a slightly better future?
Oh, I think quite a lot. I think there is a sense in which we're much more all in this together than we were before. The effects on the graduate job market are awful, but it does make it, middle class families are going to be affected by this, and that is very different again from the 1980s, where it was deindustrialization, it was working class jobs, it was mining jobs that went, but middle class jobs, sales jobs, consultant jobs boomed. The all in it together sense of this, it gives me a lot of hope, and in a way is similar to what happened a century ago. Our last peak of inequality was 1918, 1919. Things actually became slightly more equal in the 20s, although we didn't notice, and a bit more equal again in the 30s, although we had an enormous recession. The gaps between the rich and poor fell, and that partly meant that the upper middle class couldn't afford the private doctor anymore. When the upper middle class couldn't afford the doctor when they're ill at the end of the 30s, somebody suggested having a national health service. You got a national health service, and you got it because it was in the interest of the middle class as well as the working class. And I think we're in a similar situation now, where the differences between somebody graduating from Cambridge and what may happen to them and somebody who hasn't gone to university at all, the differences over life chances in the next 10 years have narrowed remarkably. Whereas 20 years ago, my generation in the 80s, you just choose what dodgy finance job you wanted in the city of London, and you had to decide not to take one, you know, if you're that. So I am optimistic, as long as people realise that they are all in it together, and they cannot all fit in the 1%, and they can't just scrabble over others to be okay while everybody else isn't. And so I am optimistic, because it's that awful. The last time things got better, World War One, and then the terrible shock of World War Two. Now, Brexit, a big pandemic, a giant recession, and Boris isn't quite as bad as a war. But if you were trying to stack up a whole load of things, oh, and then pile on enormous debt onto the young as well, biggest student fees in Europe, highest loans, and all of this. If you're trying to stir people up and annoy them, it's a pretty good way of doing that. So I would be staggered if things don't start to improve. I just think people have to be a bit patient and actually welcome the improvements that come and realize it's an achievement, rather than saying it all has to get better immediately, because that just is a pipe dream in a country that changes as slowly as we change.
Well, that definitely gives us a bit more hope for the future. So thank you very much. And thank you very much for taking the time to speak today. That was a really interesting talk. Yeah, and on behalf of everyone, I've had a lot of private thank you messages to you as a speaker. So thanks very much for taking the time. I'll end it here because it is 8:07 and we've overrun a bit. But yeah, thank you very much.
Thanks ever so much for having me, and thanks Nicole Singh for putting the links to Alison Pollock up in the chat. It's very kind of you. Thanks ever so much.
All right.
Bye-bye.